the Prima Pediatrics Healthcare Hour on your hometown station, AM 1220 KHTS. I am Dr. Rochelle Feldman, and resuming a past show under a new banner. We had previously done the Prima Healthcare Hour when we were a larger operation, and now we are big, but we're kids only. So, many things happening in the world of children and their health care over the last God knows how many years. To let you guys know a little bit about our new place, we have moved over one, so we are now in the center portion of where Prima Healthcare used to be. Prima Pediatrics is open to young people from the ages of 0 to 21. We will kick you out at your 22nd birthday unless we say we won't. But we are happy to help you and your family. We provide a full set of immunizations, vaccinations. We are members of the Vaccines for Children program, which is going to be our topic later in the show. And that means that you can get your vaccines for free if you either do not have health insurance that covers it or have Medi-Cal or Healthy Families. We are also participants in both the Medi-Cal and Healthy Families program, as well as taking all insurances, PPO and otherwise. We also have a set of cash prices for those of you who have no insurance. Hopefully that won't be for too long, now that Obamacare is about to break through. So, moving right along, we have now got 3 providers. There's myself, Dr. Rochelle Feldman. There's Dr. Amy Wagner, who will be on the show in the next few months. And Josh Rogers, who is our personally trained pediatric physician's assistant, who is a very welcome addition to our office. A new place, a new outlook, and best care as always. So, we are going to go to the topic for the day, which actually is vaccines. And this is an old topic for many people, a new topic for some, and an important topic for everyone. Just last week, I received a flyer from the LA County Emergency Health Network, of which I am a member, stating that they have had an outbreak of measles. And this occurred because a traveler from, I believe it was Southeast Asia, came in on an airplane and had measles. They had fever and a rash, did not recognize they had measles. They had never been immunized since they were from a country which in those days did not immunize. And they exposed approximately 250 travelers on that plane. What happened next is what happened in the old days, which is each of those 250 travelers carried home their measles virus. Of the folks on that plane, 3 or 4 of them were not immunized, as well as one child who was not immunized, a 5-year-old. And every one of them got measles. By the time the first case was identified, there were another 5 cases that had then ballooned and blossomed into San Diego and also into Los Angeles. Another 15 or 20 people to date have developed measles. Approximately half the adults have required hospitalization. And there has been, I'm not certain whether there has been a death yet or not. There was a question as to whether one child was going to make it. So here we have an old-fashioned epidemic due to people not immunizing. And that's a problem. We still need immunizations in this day and age because there are still plenty of people who aren't immunized, and there's plenty of measles to go around. I know everybody says, well, I had measles when I was a kid and I did okay. Well, I did too, actually. When I was a child, I had measles, I had mumps, I had rubella, and I had chickenpox. And I also used to drive in a car with my parents without any seatbelts because there were no seatbelts when I was a little kid. Does that mean that today I'm going to drive around without a seatbelt or not belt in my kids or my grandkids? No. It means that I'm gotten wiser. And so I say to all of you with good advice, get your vaccinations. When we come back, we will talk about the whole controversy with Dr. Wakefield and his spurious, meaning inappropriate and falsified study on vaccines and autistic children, which turned out to be a complete fraud. And this is a very interesting and long study about which I have some personal as well as professional experience and observations. So with that, I believe I'm going to turn this over to our announcer to introduce us to a commercial break.